Welcome to our tutorial entitled How to Intubate the Upper Airway. This tutorial was produced by the listed fourth year medical students in partial fulfillment of the requirements for the fourth year elective in clinical gross anatomy. There are four objectives in this tutorial. First, the instruments used during the intubation procedure will be demonstrated. Second, the intubation procedure will be performed in a fresh cadaver. Third, the gross anatomy necessary to understand the intubation procedure will be shown in a sagittal section of a cadaver. And finally, the expansion of the lungs and proper placement of the intubation tube in a fresh cadaver will be demonstrated. Let's begin. The tools needed to intubate a patient will be shown in this section.
We're going to be using a MAC 4 blade. Here's the blade, here's the handle. We'll be inserting an endotracheal tube, a 7.5. Once the tube is in the right position, we'll inflate the cuff right here with a 10 cc syringe. Then we'll attach the ambu bag, this part, to right here, and we'll use this to inflate the lungs.
We now demonstrate the intubation procedure using a donor cadaver.
So we have our MAC 4 blade. I'll insert the blade into the patient's mouth. I advance the blade until I am in the vallecula, and I lift upwards to move the epiglottis out of the way until I see the cords. Okay, and I see the cords. Now can I have the tube, please? I advance the tube until the cuff is just beyond. Using the 10 cc syringe, we will inflate the cuff. I'll remove the blade. Okay, and now we'll attach the ambu bag to the ET tube, and then we can check to see if it's in the right position.
This now concludes our tutorial. We thank our donor for granting us the privilege to demonstrate this teaching video to you. We acknowledge Mr. Mark Savonia, manager of the Will Body Program, for his outstanding contribution to the teaching of medical students at Georgetown University Medical Center.